The Mumbai chapter is proud to have supported 8 NGOs till date with more than 2 crores of funding and hundreds of hours of mentoring by our skilled partners in areas like strategy and planning, financial management, human resources, communications, and leadership coaching. During this COVID crisis, the SVP partners in Mumbai and across India have absolutely opened up their hearts and their networks, from doing small things like looking after their own neighbors and family within the buildings that they live in, to something as large as we have a partner who spends time in the BMC war room, and everything in between. Our partners have really stepped up and met this challenge head on, and I'm very proud to be with this like-minded group of people at SVP. So that's just a little bit about SVP. Now I'm going to move on to the main event, which you all have come here to hear. And we've got 2 great guests today, Shishir and Ruben. So Shishir is the founder and chief executive of Project Mumbai, a not-for-profit and a model of public-private people participation. He believes in social transformation through initiatives of scale, like the award-winning plastic recyclathon, where he got 1,25,000 people to recycle their plastic, and then he converted that into park benches for gardens in Mumbai. For the last 70 days, Project Mumbai, led by Shishir, has scaled great heights in the war against COVID. Shishir identifies a need or a problem, and somehow within hours, maximum a couple of days, launches another initiative to solve that problem. So, I mean, he's literally a Superman. Despite Project Mumbai just being 18 months old, they have really led the way in providing relief during this difficult time. So thank you, Shishir, for joining us.
Thank you, Amita, and thank you, everyone.
And Ruben, who's also on the call, he is a techie by training and an activist by choice. He's responsible for registering lakhs of youngsters as first-time voters through the Jago Re campaign in Maharashtra and Gujarat. He was recently awarded a Mumbai Heroes Award by the Mumbai Mirror for increasing Mumbai's voter turnout by 13% in partnership with the State Election Commission. He was also on the founding team of Served, which is a Bill Gates funded startup working towards making domestic workers financially independent and debt-free. And of course, he is a co-founder along with Shishir of Khana Chahiye. So again, Ruben, thank you. And I'm especially grateful because these are literally the 2 busiest people in Bombay at the moment. So I'm really grateful that they've taken the time to talk to us this evening. So let me ask both of you a question, which is that on what day, I mean, you know, lockdown was announced, and how quickly did you realize that this was going to be a problem of such large scale and the magnitude of the problem? How quickly did you realize that it's going to, you know, snowball into this massive issue? Let's start with you, Shishir.
So we got, so breaking this into 2 components. One is Project Mumbai and then Khana Chahiye, and Ruben will be happy to talk on the Khana Chahiye part also. He'll love to talk on that. So 15th of March is when the lockdown happened, and we were on the ball on the 16th of March. Because we had our ear to the ground, and we realized that the state administration or the municipal administration was not really fully in the know of what all needs to be done. So at 16th, when we had the first meeting internally, and we said there are, and in fact, that's also when somewhere when Ruben and I started talking. So we started putting together a dashboard for people who had started to come into Bombay, and they would be the people who were unwell, who would go into, there was only the Kasturba hospital in Mumbai, which was taking positive patients. We focused on those who had to be home quarantined, and said, what if they're home quarantined? How do they get groceries? So Project Mumbai does have a large number of volunteers, thanks to my plastic recyclathon. And we got all of them together and said, can we reach out to these people who've come down from Frankfurt, from maybe America, from Singapore, and who are now forced to stay indoors? They should not be compelled to step out only because they've run out of medicines or grocery. And that was the first initiative that started around 17th of March when we launched. So, and from then on, it's just been grown. Ruben, I guess you may have a few things to add as well.
So what has happened is that as soon as the lockdown was announced, we were receiving a lot of information from a lot of people as to the widespread hunger. And we said that we need to do something about it. I reached out to my co-founder Patrick Muni. We're on the field, by the way. That's my co-founder Patrick Muni. And we I reached out to Shishir, and we started with 1,200 meals on the Western Express Highway. Then we saw all over the internet there was a lot of requests from people on social media, and we said that let's try and quantify this demand. That's where we came up with the idea of a hunger map. So we had data points on our website, social media, people calling us, people reaching out to us on WhatsApp. We quantified all of this. So that was the demand side. We as individuals didn't really have experience in food manufacturing or food production at scale. So I got in touch with my very good friend Munaf Kapadia, who happens to be from the food industry, who then put us in touch with Niti Goyal and Pranav Roongta, who are restaurateurs. They're part of the National Restaurants Association of India. And we then, after discussing things with them, realized that there are a network of restaurants with unused capacity because because of lockdown, they're not being used. And we activated that capacity on the supply side, and we married the demand side to the extent that we could raise resources. We started with 1,200 meals on the Western Express Highway. Today, we are functional across Mumbai's 5 arterial roads, which is the Western Express Highway, Eastern Express Highway, Link Road, SP Road, and the LBS Road, start to end. Each of these roads is approximately 25 to 35 kilometers long. And that's, of course, with the focus on the homeless, the marginalized, and daily wage laborers. In addition to that, we are also active on clusters. Clusters are basically slum pockets which have been pushed into destitution because of the lockdown, because of pausing wages and bringing all economic activity to a standstill. Then we are, till yesterday, we were active at all the railway stations. So we had adopted the CST, the Bandra, and the Kurla terminus, where we ensured that every passenger coming in there would basically get a bottle of water, biscuits, food, sanitizers, and a mask. And that's again, hats off to Shishir for helping us get in touch with the right corporates and getting the right sponsorship. And then, of course, we were active on the transit points, which is the 3 transit points of Mumbai. Dahisar on the Mumbai-Surat highway, Vashi on the Mumbai-Bangalore highway, and Thane on the Mumbai-Nasik highway. So that's how our operations have panned out. We are over, Patrick, 120 plus volunteers? 130. We are approximately 130 plus volunteers on ground. The reason why we are here out today, because we are in the field, and we just got tested thanks to Shishir here again, who's been a driving force behind us. Yes, so that's exactly what we at Khana Chahiye have been doing for the last 2 months. And the bulk of our funding has, of course, come through corporate philanthropists. But of course, we've also been highly successful online by using the Efforts for Good platform for crowdfunding, and we've been able to raise around 78 lakh rupees as of today.
So in total campaigns, we have raised more than 1 crore because there are campaigns on Efforts for Good. One is for Khana Chahiye.
Patik, you're a bit far from the mic. You're not super audible.
Am I audible now?
Yes, much better. Thank you.
Okay. So basically, we're running 3 campaigns on Efforts for Good. One is primarily for Khana Chahiye, which is for cooked meals. The second is for Ghar Bhejo, which is for transporting migrants from the state of Maharashtra to various other states. And the third is for Samarpan, which is an NGO, which is where they have pledged to give us sanitization kits, including sanitizers and masks, to be donated. So they've donated the complete kits to us, and they are raising, and we are helping them raise that money. And in total, we have raised some 1.25 CR online.
That's great. So I have a follow-up question for you, Ruben and Patik, which is that, you know, given the state of the lockdown and the kind of massive geography that you cover, it's probable that, you know, you haven't even met many of the volunteers, or you've never had a face-to-face meeting, or, you know, so where did these people come from? How did they find you, or did you find them? And how do you manage the logistics? Like, is there somebody in your team who's handled logistics for a corporate, or how have you, you know, scaled up like this so quickly?
So I think two things. One is
Ruben, you're not audible.
okay. Am I audible now? Is this better?
Much better, yeah.
So I think to start off with, I reached out to my friends who are part of the Litmus Test project, where we already have a relationship with Shishir. We're already working on a few projects prior to this. So Patik and Anik and Swaraj. And these are like my immediate friend circle, in addition to basically being colleagues at the Litmus Test project. Then when we reached out to people, of course, you had Shishir's database, which was very helpful in basically getting the first set of volunteers. And as we started putting the word out, people wanted to volunteer. We set up an onboarding process, you know, which automatically would disqualify somebody who basically had elders at home and couldn't basically self-isolate herself or himself. And then, of course, we have Patik, the man behind Khana Chahiye's operations. Maybe you would like to just add a line or two there.
So, am I audible? Yeah. Okay. So, on the volunteers bit, Sishi's database was very helpful to us. Apart from Sishi's database, we also would like to give credit to Facebook, because the network that we've built over time with various things that we have done came very handy, because as soon as we started posting our pictures, people started getting in touch with us, like Manoj Shah, who has been one of those guys who was on my Facebook, and he reached out to me that, you know, okay, how can I help? And he comes with a previous background of startup which was into HR, and I asked him that, okay, if you can come on board and manage our volunteer force. So he came on board. He built an onboarding process along with me, and we started onboarding all the volunteers that we would get from our website, social media, from our local contacts, and that's how we built a team. Today we are almost 130 plus strong team.
So just to add something to that, I think in initial days, when we started off, what I realized is a large number of people are at home and just have lost their purpose in life, because everybody seems to be just cooped up at home and they don't really have anything to do. And once we reached out to Shishir, and credit to Shishir that I called him and I just asked him, hey, this is what we want to do. And he was more than happy to get the entire process anchored in Project Mumbai. And hats off to him. He's supported us by standing like a rock with us.
Without a question.
And each time that we went with him with a problem, he basically came up with a solution.
Yeah.
So that is Shishir. And I think it's about giving people purpose. Of course, to begin with, we all were scared about the virus. We still are. And which is why after 60 days on the being on the field, we got tested, and we hope that this is one test that we'd all like to fail. But I think once we put a plan in place, we actually use N95 masks. We use our sanitizer bottle, which we use at all points in time. We came up with face shields that, ma'am, if you remember, we reached out to Makers Asylum and got face shields for everyone. So we did take the precautions and use industrial grade material to combat the virus when on the ground. But once we were there, I think things just fell into place. And all of the people here, we have people who are MBAs, we have doctors, we have engineers. That's me. I'm an engineer. He's an engineer too. We have lawyers. So I think this is a citizens' movement of Mumbaikars wanting to do something for the city. And as Shishir always says, Mumbai ke liye kuch bhi karega.
Super. Thank you, Ruben and Patik. So, Shishir, over to you then, because you're clearly the man of the moment. You want to tell us about how you managed to layer on, initiative after initiative at Project Mumbai. I've lost track, and but I'm sure you haven't. I know that something that you put out, I think maybe 48 hours ago, has gone viral, which is the non-COVID hospital dashboard. But why don't you start at the beginning and kind of say, what was the first thing you started, and how did you add more and more things?
Amita and for all you, the energy that you hear in Ruben, Pathik, and so many names that one has lost track, that's the energy that I get. That's one. Because otherwise it's pointless. You can't do things alone. It has to be collaboration. So quickly walk you all through, and I don't want to bore you all. As exciting as the food journey has been. So I spoke about helping out people who are stranded, who had come from abroad. Our next step, around the 19th of March, 2 days later, was senior citizens who are living alone in Mumbai. So as Project Mumbai, we started reaching out to those, and there are so many of them, and we started providing grocery kits. My strength, like Ruben, Pathik have spoken about, is my army of volunteers. We call them Good Samaritans, and they are loyal. They've been with me for the last year and a half from the time Project Mumbai has started, and we mapped close to 1,500 volunteers over 100 locations in Mumbai, and they all started writing to say, I live in Khar, this is my number, happy to help. I live in Santa Cruz, this is my number. I live in Nalasopara. Senior citizens started reaching out to say, don't give us grocery kits. My maid hasn't come in. I don't know how to cook. There were 80-year-olds, 90-year-olds whose family members were abroad, or whose family members could be in some other city or even within Mumbai, who could not travel due to the lockdown. So started with one, people who had come from abroad, medically quarantined, then the senior citizens and people with physical disabilities living alone. We started reaching out to them. Then just before the lockdown, we realized people were getting stressed out. So we started 2 mental health helplines to reach out to these people. We have close to 90 mental health professionals reaching out in 8 different languages. One with people with special needs therapists, and second, a regular mental health helpline. Then the state government reached out to us. The hospitals were going through a crisis. Their canteens had shut down. So the canteens were run by migrants. They said, can you please handle that? Till that time, Khana Chahiye had not yet started. So food was still a very alien subject, except for what was kept on my table. We started checking out, and we started providing food to doctors, KEM, JJ, Kama, Sion, Cooper, Mantralaya, St. George, and maybe a couple of Navi Mumbai hospitals. So we are feeding close to 2,000 doctors every day for the last 70 days, breakfast, lunch, and dinner. Then we got into medical equipment, and the country's largest donation of PPE kits has been done by Project Mumbai, 2 lakh PPE kits, which is actually no small amount, which even today as I think about it, and because the order was so huge, the manufacturer was so excited, he said he's giving me 10,000 PPE kits free, which we got him to design in khaki color for the Mumbai police. So that happened, and around that time, when Ruben and we got talking, my first conversation to him was, I've got these volunteers, and Ruben is fantastic on numbers, said, can you help me map them? From there, Khana Chahiye happened. From then, we moved into, since Khana Chahiye has been briefly discussed, we created something called Project Mumbai, a banana for every child. Because everywhere the trucks were going with food trucks, we saw children who were hungry. And we started putting in 500 bananas in every truck, and wherever you could see a child, let's gift him a banana. So a banana for every child happened, and then Amita, you also came in, your biscuit packets helped out, and for every child we created, Pathik and team created these small gift bags to say even the child with lesser privileges, can we gift them those, sorry, Ruben, what did we call them?
Chota packet.
Chota packet. Yeah, and then we gifted them those little packets of biscuits and bananas in it. And everywhere you could see, just give them away. So as of now, every day we give 4,000 bananas. From then, we moved on to other initiatives was the non-COVID hospital list that we put together. That's happened. And the journey just keeps going on. We started putting vanity vans. So the film fraternity reached out to us, say, we've got these vanity vans, what can you do? We reached out to the cops. Women cops are out on bandobast duty. They're day in and day out. We see traffic cops and women cops. We keep wondering, where would they go to a washroom? in earlier non-COVID times, they could have gone to a building or a hotel nearby. But in COVID times, no building is going to open doors to anyone. And we said, can we have these vanity vans? And we put them up in 16 locations where women cops were there in larger numbers. We filled them up with soaps, with biscuits, biscuits from you, Amita, and we put them up with sanitary pads so that these women could have some space, safe space as well. So that's what we've been doing, and these women cops are so happy. They've got some safe space. And while Khana Chahiye was going on, last week, Star reached out to us, and Uday Shankar of Star, who's already partnered with me on the PPE kits, he was the one who donated those 2 lakh PPE kits. He wanted to do something on food. And we were working out on transit passengers, and we said, can we look at food? We already had Khana Chahiye for reaching out to people, and he said, I'd like to do something big. How do I work out? And we created a 1 million mission. And what we partnered with Star is calling it 1 million meal mission. And we've integrated that with Khana Chahiye so that no migrant, no citizen leaving Mumbai should leave on an empty stomach. And that's going on right now across the locations that Ruben is talking about, across the transit points, across the various routes. The idea is the state has failed us miserably. The city administration has failed us. And can we reach out to people? 80% of the work that should have been done by the state, which is where the non-COVID hospitals came in. For the last 15 days, I've been trying to work out with the BMC to say, let the data out on COVID hospitals. Every night, the municipal commissioner, when Praveen Pardeshi was the commissioner, he had created a WhatsApp group about 2 months ago, and I appeared on the WhatsApp group. Every night, trust me, and some of you, I don't know whether somebody else in the government is here or not, every night, from 7 in the evening till 4 in the morning, and often I'm up at that time to see what's going on. 11 o'clock, 70-year-old patient looking for a COVID bed. Where do we take him? Then the CEO of X hospital says, I'm full up. Half an hour later, somebody says, sorry, I'm full up, let's take him to NSCI. NSCI says, sorry, we are full up, let's take him to Bandra. There have been n number of cases where patients have lost their lives in ambulances because there were no beds. And these situations have arisen because not because beds are full up, because there's no transparency in this data. And when we started talking to the municipal corporation, said, why the bloody hell can't you keep it open? Whatever the reason could be, we said, can we help them create a dashboard, realize this vendor changes and that vendor changes. One was to keep fighting. The second was to look at the problem area and a solution. Non-COVID was as challenging. People like you and me, there's a fracture in the family, a child needs help, a senior citizen has a dialysis issue, a pregnancy, maternity issue comes up. What do? We don't even know. I had 3 friends of mine whose parents lost their parents and didn't have a doctor to sign the death certificate. And why was this happening in a city like Mumbai? That's when we put together, we went to the BMC to say, do you have a list of hospitals which could be open? They said 60 days ago, somebody had given us some list. Again, my volunteers came to my rescue. We made them sit together and we called each and every hospital. We started calling them for 48 hours. Of the 70 hospital lists, 50 hospitals we reached out to. We made a list of 9 or 10 things. Are you open? Yes or no? What's the contact number? What's your geolocation? Who is the point of contact? Do you have an ICU? Do you have a general ward? How many beds do you have? Maternity facility, pediatric facility, senior citizens, chemo help, dialysis. And then some of these things were everyday routine, but the beds was dynamic. So every day from the time that we reached out to them, my volunteers call them twice a day to check on the bed status. And you click on that link, you get a live status of this hospital in Khar, how many beds yesterday, how many beds today. So you don't really have to worry, call a 1916 and keep waiting for 5 hours, 10 hours, and you breathe your last. And this is where I feel that there are problem points everywhere. So many things can be done. That's where Project Mumbai reached out to say, we are a go-to organization. We have no interest but the interest of the citizens. And we've got people like you and me ready to help out because we all care for the city. So that's where, as Ruben said, Mumbai ke liye kuch bhi karega. But of course, we've not limited ourselves to Mumbai. We've reached out to as many citizens who need help. So here we are. Avita?
That's amazing. I mean, I think, the value that you're adding is absolutely critical at this point. because what you're saying is absolutely right. I mean, you can have a different kind of medical emergency, and at this point, everyone's nervous. They don't know where to go. They don't know who to call. And so to have live, real-time information is super valuable.
Amita, sorry to jump. Just in fact, one more thing that Pathik forgot to mention. We also started after Khana Chahiye. We also started something called Ration Chahiye, because that was the other space that we, Ruben, Pathik, if you remember, we realized that there's a huge space. Cooked food was at the end of the day we need it to people to sustain themselves. So cooked food has its limitations. People need to start now starting their life again. So we got ration kits thanks to donors. Okay, and we got these ration kits, and we've now started so close to 50,000 ration kits that we've delivered in different parts of Bombay, and we're helping people start resume their lives in some way or the other. Every day we get calls. As of now, we've got close to 18,000 ration kits. The demand has increased. There are journalists who've lost their jobs. There are people who've lost their jobs. And the last point was we also started a mental health helpline in the government of Maharashtra, which is servicing 12 crore people now. And the first day that the Chief Minister announced this mental health helpline, 19th of April, on that day from 1 o'clock till 6 in the evening, we got close to 1,500 calls. And of those 1,500 calls, close to 1,400 were only for food. You can imagine it's a mental health helpline, but people calling for food because that's how badly managed the system was. And that's what we were trying to join dots and help people.
So, it's interesting that you bring up the ration kits, because actually when the lockdown started and everyone was very focused on donating ration kits, and then probably within 2 to 3 weeks, the entire migrant movement started and all of our attention did get diverted to that. But in the meantime, I'm thinking just like, we all need to step out once every 10 days or 15 days to buy, your basics. In the same way, you've handed out ration kits on day 1 of lockdown, but by day 15 or by day 30, those same families are going to have that repeat need. And in the meantime, I hope it isn't that donor interest has moved to a different area. So if you could just talk about the kinds of people who are still in need of rations, and if you could give us some sort of visibility on, have a large percentage of the urban slums emptied out, or are there still a lot of people staying? What is their position right now in the slums in terms of, is there any source of income? Are rations even available for purchase easily? Just give us a picture of what's going on in a slum today. Who's left, who isn't, and what are they eating?
Bombay, even if you clean Bombay out, there'll still be lots of people left in Bombay. So that's how the size of the city is. Having said that, nobody has an idea of how many people need to be mapped, possibly except Pathik, Ruben and team, which has been mapping the food demand. And they've done it so well. Otherwise, the city administration truly has no clue. Maybe they were hoping for this entire migrant issue to escalate and people leave. There was a video that was put up by the Khana Chahiye team about a train leaving for West Bengal last night. And a bus reached the station late. And these people were rushing to catch the train. The cops finally helped the train to stop. You can imagine the desperation on the faces or lives of these people. It was almost like the last breath left. What if we miss this train? And there are so many people who miss this train. So slums or lots of pockets in Bombay are full of people who still need help. They've run out. Now you might say, what is the public distribution system doing? They are providing food, but there is no clarity. There are lots of organizations and good people wanting to and giving support, but there are still gaps which do exist. Attention keeps moving on, demand still keeps coming in. But if you look at social media, the number of good people who've come out, I've always believed, and I'm sure my colleagues here believe, everybody has a good bone in them. This is the time all these bones have come out and people have benefited. There are people who've lost out, and that losing out is not as much as food grains not reaching people, but it's more to do with absolute lack of communication. I don't know whether I'm going to get food. I don't know whether I'll be able to get home to my state. I don't know what needs to be done to get my pass. or whether I need to pay. I don't know whether a certificate is necessary. I don't know what all is required to do whatever. So this lack of clarity has compounded the anxiety, stress levels, and then people will start hoarding and stuffing because they say, okay, what if tomorrow never comes? And then because of that, this problem has got aggravated that when we started giving food kits, so the trust issues come in. The number of cases that we had to bring in to say, have you all really received grocery kits or not? We went by trust because if somebody is reaching out to us, he needs it. But yes, there are people who may have got a double kit or a triple kit, which is, I don't blame them. We are holding stuff because we don't know when the lockdown is going to end. So I don't blame these people because they are living in really pitiable conditions and nobody really cares. For instance, when we started Ration Chahiye, I got a list of from the ward officer. The municipal corporation asked us, Project Mumbai, can you take care of 7 wards? Okay. They were asking us, take care of 7 wards. What are they doing? But this was not the point, time to point figures. We took up 7 wards. Okay. Ruben handled 1 ward, Patik handled 1 ward, I was handling 1 ward, and we took up wards, and wards are huge. And then I asked the ward officer, which is the point of contact, who's a senior BMC officer, to say, give me a list of requirements. 1 ward gave me a list of 10,000 grocery kit requirements. I said, can you give me a breakup? What's this 10,000 about? Who's the beneficiary? Of this 10,000, 3,000 was from a local MLA who's from the Shiv Sena, another 1,500 from a BJP MLA, another 800 from a BJP corporator. So close to 7,500 was from elected representatives. Why should they be taking free kits which we are giving away and which are paid for by donors? What happened was we are giving kits to these people because it's going to the needy, and these elected representatives are taking them and giving it to the people to say, you know, हमारी तरफ से free है, ले लीजिए, अगली बार हमें vote कीजिए. And then of course we are suckers all the time. Donors are giving money because they can see those drafts and data to say Bombay is still so underserviced. So lots of these gaps did exist, but at this point we were not here to look at mistrust issues. We were looking at how can we help people, because even if one person goes hungry, that will make us feel bad, which is where Ruben, Pathik, Manoj, KK, Neeti, all of us would have these conversations and say, how long are we going to continue? Should we continue and stop and wait for the state to take over, or the state still has no answers? Just a last point, I'll talk on the grocery part. We were asked to provide full grocery kits, okay, which is 800 rupee per grocery kit, and we ordered first, and then they said, the state suddenly said, state when I say the municipal corporation says, don't give us full kits, you only handle the supplementary kits. Now, supplementary means the chanas and the namak and the mirchi and the salt. The main part, which is the dal, the chawal and the atta, we will give. Okay, so we had 18,000 kits ready with us with supplementary kits. The main portion was to be given by the municipal corporation. It's been 20 days and we still haven't got those main part of the kits. In those 20 days, these 18,000 kits were lying with us. And now what we have done is, so rains are around the corner. The municipal corporation doesn't have a solution because there are so many cooks out there. What we've ordered, thanks to our donors, in this case Wipro, which has been generous enough to say, don't worry, we'll pay you the money for the main part of the kits. At least let these kids go out. There are people who are hungry. So we are here, we're doing some great work because there's energy among people. Everybody feels sad. Those who are at home feel, I'm at home, so let me do in whichever way I can. And donors who are generous enough, who are supporting us. But yes, has the state lived up to its promise? No. Has the state lived up to its reputation? Yes.
Thank you.
I just want to add something to this, may I?
Yeah. And actually, I was actually going to direct my next question to you. So please do add. And also, I wanted to, if you could elaborate a little bit on the work you're doing on the arterial roads. And again, who is left there? What kind of condition are they in? And do you foresee a lot of issues now? You know, the first rain showers came overnight last night. And so do you foresee issues there? And I mean, I know you guys are always one step ahead of the game. So what are you thinking will be the next steps?
So I think, you know, as rightly pointed out, at Khana Chahiye, we've been lucky to have some great mentors like Ujjwal Thakkar ji, like Rakesh Singh of Bharat Uttan Sangh. And we've always been, and like Kishore Mandhyan ji, the former political advisor to Ban Ki-moon of the United Nations. And we've always been very lucky and very privileged to be able to speak with them and plan so that we are ahead of the curve. And also, as Khana Chahiye, as an organization and as a movement, we've basically evolved such that we've responded to whatever crisis this pandemic presented. So when it was the highways, the reason why we took the highways was when we started off with the highways, we realized that the way the containment was being implemented, or rather the curfew was being implemented by the police, was to ask people to stay in the local areas. And so there would be some local charity, but people wouldn't reach to these arterial roads. And it's like these people were just falling through the cracks. And we started the Western Express Highway, got a set of volunteers, mapped a kitchen supply to that, and over a period of time went to other roads, other arterial roads. But before I come to that, let me come back to the question that you asked, Shashir. What's happening in a slum today? I think if you look at slum pockets, they're divided into two parts. At least that's the way I look at it. This is basis the demand that's been come to us. One is the containment zone. So as of this morning, there were a total of 1,586 containment zones, a large part of them in slum pockets. And then you have slum pockets which are not non-containment zones. And there is a huge demand of food from these areas. One is amongst migrant laborers. It's not that everybody has basically left the city. There are still a large number of people here. There's still a large number of people who do not have the apparatus to cook, and that's our primary responsibility when it comes to Khana Chahiye. And we are doing approximately 75,000 meals a day right now. And then if you really look at the slum, the problem is with the way, as we pointed out, the way grocery is being distributed by the BMC, because we are obviously trying to do something that the government has failed to do. But of course, we understand the scale of the problem. It's all hands on deck for everybody. So we're not passing the buck, or rather, we are blaming people. But all that we are saying is that you have two categories of people who have a ration card and can go to the PDS, as Shashir mentioned, and we already can see the system being overburdened, and people who do not have ration cards. So when you do not have a ration card, you either call up the helpline, which is the state government helpline, where they take your details, and then you have a list of people which is managed by the deputy collector. And then you have an independent exercise being done by the BMC across the 24 administrative wards in Mumbai. So if you really look at the slum situation, I think you're going to have a situation where demand will always outstrip supply. I think the BMC is only now woken up and now has come up with a Maha Ahar app for basically avoiding duplication of beneficiaries when it comes to giving them the relief material. But broadly, there is still demand for cooked meals, and I think I told Shashir this at the start of the whole thing, that the lockdown has in a way ceased all economic activity for the blue-collared segment, and we as a group, we as a collective, are committed to continue to the extent that we can, given the generosity of philanthropists like you and corporates like Wipro, Star, and SBI Caps, that we'll continue till the lockdown continues. But just about the rain bit, Pathik, would you want to add what is our preparation for the rains, and now that we have offices opening, how are we going to tackle that, given the limited amount of time that we will have when it comes to the volunteers?
Hi guys. So we are completely changing our strategy in terms of ops, and we realigning and restructuring our operations now to be driven more on a hyper-local kind of model. So our idea is to empower our on-ground volunteers, start a fusion of ration so that less of contact. We don't want daily distribution happening because of the rains coming in. So hence we are moving a lot of our force on ration. Because we already have identified demand. We know these guys, we know this target segment, we know why they don't have access to food. So the answers are pretty much there. It is just that we're changing our complete operations model to suit those answers, and we are ensuring that every person here still gets catered in the monsoons, even while monsoon is there, because we're going to be moving most of them on ration rather than cooked meals. Cooked meals shall stay limited to only those people who don't have the apparatus to really cook a meal. So that's on basically monsoon and preparedness on monsoon. And something that I missed to say while before Shishir started talking was about ration chahiye. Agreed, Shishir. Thank you for bringing that up. Right now, as you see in the car, we are at our go down here in Goregaon, and we've just picked up around 20 kits to be delivered to a particular set of people who are told to us that they are identified by our team members that they're really in need. They have not got food for the last literally 7 days. So that's about ration chahiye.
So just one small thing for the monsoons, there are 2-3 things that are being discussed. I have been in touch with the BMC, where the BMC has these food distribution points. We are still trying to put that onto a map and obviously try and get. Am I audible?
Yes.
Yes, you are.
Yes.
Hello, am I audible?
Yeah, Ruben, you are.
Yeah.
Okay. So, sorry. So, for the monsoons, number one, we are having a demand reassessment across all our routes and clusters. Our people on the ground are speaking to our POCs, which are our point of contacts through whom we distribute this food. Second, Neeti Goyal, who is our co-founder, and Pranav Roongta, who is in charge of food supply, we are also trying to see what is the best food which we can give. So, there's obviously a change of menu on the cards, because with monsoon, with summer, we would have the problem of heat, but with monsoons, we have excessive moisture, and hence there is the possibility of food spoiling. So what is the kind of menu that we're going to use there? And third, I was also in talks with parishes, which are more than happy to basically give their schools and their churches, and maybe that can basically be used as a distribution point for the homeless, because distributing to people on the highways, especially during the rain, might get a little tricky. So that's something that we've still not internally taken a call, and that's something that we'll still take it once we have. That's something that we'll take a decision about once we have all the demand reassessment from the ground.
Great, thank you so much. Very interesting to see how you've deep diving into all the details and figuring out exactly how to reach everyone in a vulnerable community. I can only imagine the logistical challenges, working with so many different agencies. So Shishir, Ganesh has a question for you, which is that great work, but how do we make this an ecosystem play where every entity, government, corporates, NGOs, and philanthropists enable this wonderful scope of work to truly scale? So, I mean, do you have any thoughts on how we can improve collaboration so that there is a multiplier effect and the work surges forward?
I think a lot of it blame comes on people like us, all of us, because we all love to live in silos, which applies to non-profits also. I'll give you a very simple example, and Ruben and Pathik know about it. A corporate house gave money, donated money. We're very grateful to them. I'm not naming them right now. And then at the end of it, a part of the money was not used for because there were so many emergencies happening every minute in the first 15 days. Part of the money was used for something else. And then, of course, I told them, this is the report. It was not used for maybe food, but it was used for, let's say, sanitary napkins for women cops. As noble, maybe I saw it as noble, maybe they did not see it. So I'm sorry about it, but this is what it is. This is my apology. I'll give it to you in writing. And this is where it was spent. The other option is either you accept my apology or you take the money back. And they ask for the money back. Now, I'm saying that so there's one side there. The other side is where we as non-profits or organizations love to live in silos to say, why should I talk to them? Why should they talk to us? I think it's important that those silos need to be broken down. As we talked this afternoon, we had this. So Project Mumbai is now putting together a larger plan of what next. Because while all of us are about now, we also need to think about tomorrow. So about 20 days ago, we got together and Project Mumbai has put together a plan on post-lockdown short-term and a post-lockdown mid-term. Forget long-term. And we don't even know when the lockdown or Corona is going to go away, if it will. So education, healthcare, um, transport, and so these are and entertainment. These are 4 areas we're working on. We put together a detailed plan, but the plan is not about Project Mumbai implementing it. The plan is about can we get as many people who are like-minded to come together and create a kind of an umbrella team to say let's all chip in and create a model of public-private people participation and say let's all do it because it all going to impact us. So answering your question, Ganesh, it's important that more and more people come together, leave those differences aside, and then come on a common agenda because adversity brings the best among us. And this adversity has really brought all kinds of people together. The number of people in the last 70 days that I have fallen in love with without even meeting them is phenomenal. There are so many good people around, and it's just so amazing. And now all I need to do, I know maybe once I meet them, it might get the fairy tale might get over. But the fact is they're so good. And now is the time because the goodness is high, the crisis is high, the need is high, and we all feel commonly to do something about it, and let's make it happen. So, answering your question, Ganesh, it's important this teams and say, let's do this thing together. Everybody will get a place in their sun because that's always the worry that what if I do it and I don't get the mileage? There's enough room for everyone in this space. We are happy to give room to everyone.
Super. So
I just want to add something to that. May I, Amita ji?
Please go ahead.
So just to add to that, Ganeshi, at Khana Chahiye, Shishir, we reached out to the BMC saying that we are a group of professionals and we have time on our hands and we're doing this and we're already being able to create impact at scale and we'd like to replicate that at the city. So can we sort of help you? And even a small things like that, we were disappointed when the BMC was indecisive, and it's only now that we finally working with the BMC at close quarters when it comes to the food distribution bit. So one is, I think, to be able to replicate it, no matter how many NGOs come together, you can't substitute the government, and the government has to do the heavy lifting. We are more than happy to plug in the gaps. That's number one. Number two is, I think, the good part about all of this, at least this movement, is after a long time, it's not only about the Ruben Mascarenases, the Patik Munis, and the Shishir Joshis. For the first time, we are seeing a lot of new people without any previous background when it comes to activism or social work. Volunteer their time. But I think prior to this, it was just the same set of people saving the road, saving the mangroves, saving RA, etc., etc. Now that we have a new set of people, and hopefully we have a much more responsive government, given the last 2 months of their experience, we should see a larger ecosystem at play.
Thank you. And Inakshi has a question. So she was wondering that whether cities need a permanent citizen crisis task force set up, and how will we leverage the learnings from this for future crises? Will there be someone, will it have to be again NGOs who will document all of this and have systems in place, or is there some again larger platform on which this can happen?
I think if we really, I was looking at the disaster management plan that the BMC had, and while it has thought about a lot of things, it has not thought about citizen participation. So yes, that is, I see a very large lacuna as I see it in the present PMC set of operations. So there is need of, at least maintaining a repository of people who can volunteer their time. And, if at all there is a need, people can basically be mapped given their skill sets and their local geographies with the PMC helping this entire effort. So yes, I think there is need for that. And I think, that is a very good point that we should be working. Yeah, but then you want to add something?
So, Amita ji, here at Khana Chahiye, we are, so in our small way, we are trying to address this as a permanent thing. Whatever we've learned over the last 2 months, whatever demand we've mapped over the last 2 months, we are turning it into a sustainable model along with the volunteer force, and we are mapping even the volunteers along. So we're building a network on a very small scale. Of course, the discussion is much larger, but on a very small scale, what we're doing is we're building a volunteer network which would address this hunger issue at least across the 24 wards of Mumbai in a more efficient and sustainable manner. Okay, that's a social enterprise that we are looking at to continue with Khana Chahiye as a brand.
Can I just add here, Amita, to taking to a slightly larger context, is somewhere, and you interacted with Venkat closely, Venkat of formerly of Give India. And so Venkat and I have been working closely on creating what we believe is every Indian should volunteer. And we have for the last, in fact, COVID happened, so things went onto a backseat. But we're building a kind of an activism space because we do believe that a lot of people do want to volunteer. Maybe they don't know where to or how to go about it, but there hasn't been a very sustained mapping exercise. So we've started this initiative called Every Indian to Volunteer, and the first pocket that we started off as a pilot was we created it as calling it the pin code experiment. And so we all live in pin codes. So we are picking up pin codes and then building, can we look at every citizen in that pin code, can he volunteer in a sustained manner for a number of hours throughout the year? So we started with pin code 57, in fact. I think, is that what your pin code is, incidentally? So pin code 57 is where we started, which is Vile Parle. And we got citizens groups together, we got restaurants, we got senior citizens, we got different kind of youngsters together. We began mapping the exercise. It went on for about a month and a half, 2 months. And then this was till end of Feb, and March is when the world turned upside down. But that's something where we're working on. Can we get every Indian to volunteer, do something for others? It's Daan Utsav in a much grander and a pan-India, pan-365 manner.
That's fantastic. I mean, I think that, after so many years and after so many years of looking the other way or pretending that we don't know the reality of most people, the COVID situation is kind of like, ripped off the curtain, and now we can all see. And I think there is a real genuine desire amongst people to see a paradigm shift in the way things happen. And so, these volunteering initiatives will be very, very useful going forward. I incidentally live in 56, so I hope that after 57 you come to 56. I'll sign up very happily.
Move over to 57.
Amita, I happen to be your neighbor. I live at Tivla.
I know. So all in the neighborhood here. So I just want to get a sense from the both of you. Do you have an idea of what the next major hurdle is going to be for people living below the poverty line here in Mumbai? Do you think it'll be a lack of resumption of economic opportunities? Will people not get their jobs back? And I know that it's a very, very different thing from what you're doing, but do you have even any direction in which you are thinking about livelihoods? And tell us what we are all meant to do. How do you need each one of us who's on this call today to collaborate? What kind of ideas do you need? And apart from ideas, what kind of support can we start providing, apart from what is already there, which is, paying for ration kits or paying for hygiene kits or doing the things that we already know about, but what are the bigger opportunities that you see for people who are like-minded and interested to support what's going to come in the next 2 months, the next 6 months, the next 1 year?
Ruben, go ahead, then I'll answer.
No, Shishir, I think you start off and maybe we'll add.
Okay, fair enough. So I see mental health as a big challenge, more than anything else, and that's here to stay. And it cuts across economic sectors. That's one. Job worries, all this will most definitely be there. Again, that is going to run beyond all this. Healthcare and mental health. These are two challenges which are going to be very, very strong, because we don't have a healthcare system. So while at one level we might say that a pandemic like this comes once in a lifetime, so the city, no city can be equipped with something like this to handle it. I disagree here. We are not even ready for 1/10 of what we've seen. So and we are being governed by, and this is not about this government or the previous government or whatever, but Mumbai has been governed by a party for the last 25 years. So, and the same party is here. They could have done a better job of handling things, So we have no mapping. So that's one thing. There is no census in the real sense of the kind of people living here, except when elections happen. So the challenge that I see is things going from bad to worse, because this, as P. Sainath wrote in one of his pieces in an interview, he said, now for the first time we realize that there are migrants. So far, we never really realized those migrants being around us. So yes, food issue, healthcare as in healthcare infrastructure part of it, and mental health. These are four areas which I feel are going to stay of this. Food issue, yes, at a larger level with Khana Chahiye, we'll try to see whichever way it needs to get resolved. There are donors who will try to put in their own mind. Mental health is what we are working on now, education and mental health, where we are trying to put together a robust plan where how can, despite this world coming upside down, can we get education into the lowest segments of the society through digital forms, through audio video forms. That was the plan. That was the discussion we had with the education minister today. And we are building a toll-free mental health helpline now across languages for people. My big worry is once lockdown gets over, once work starts, people like here on this platform will start going back to work. And then the migrant issue is one more thing on page 3 or page 5 or page 15 before it just goes on to the 23rd page of a 22-page newspaper.
So I want to add to this. Amita ji, may I?
Go ahead, please.
So number one, what we've been hearing, of course, is lack of economic opportunity. Let's take that segment of the blue collar workforce, which basically has job certainty and income certainty, namely the domestic workers. And today you have a Times of India report where they found that 85% of the people that they surveyed hadn't basically been paid their wages. So that, coupled with the fact that you have demand being extinguished, we will need to basically handhold the people for a longer time. Second, we are also exhausted, and we don't do this full time. We have our startups, we have our enterprises, we have our consultancies, and that's true for all volunteers too. So of course, we're trying to innovate and try and see how we can continue doing what we do by being more efficient, by spending the same much little time individually, by getting more people on board and still having the same impact. Third, and again, I come back to the government, and Shishir has been a little charitable. I'll go a step further, and I'd say that what we're doing is nothing but extra tax, because we already pay taxes. The government's already supposed to do what it's supposed to do, and that's not really happening. And I just hope that over a period of time, all of our learnings, the government becomes much more responsive. Of course, we need people, we need civil society to step up and work, and I think we're all doing that. but more than that, we need to have a detailed action plan, and let's look at the healthcare system right now. We already see it being overwhelmed. You just have 22,000 beds and approximately 37,000 positive patients, and this is even if we take into consideration government policy, we are not testing asymptomatic cases. So given all of these facts, I think going by the present mathematical model as was announced yesterday, we're going to peak in July. So this is a longer fight, and we need to have a way to be sustainably involved ourselves, both in the system, and I don't know, it can be an ecosystem of support. It can be maybe helping us get people who can work full time on it, so that the volunteers can continue being volunteers, so that we can sustain from a longer time. And this is beyond the writing of checks and supporting us, which I think you'll already do.
Great, thank you. That's a good point. I still, Shishir, I would like you to give even more concrete ideas of how, we can participate. Like I said, everyone has done the basic stuff. We've all contributed. We've looked after our own staff and our own circle of service providers, etc. But I want to think of ways in which you can get people involved sustainably and for a longer time. I know that you were already working on something, but I think what I'm requesting people to do who are interested to connect with Shishir or Project Mumbai on this is to type in your email IDs in the chat box, and Arshia will capture those and she will connect you. But Shishir, give us a little more, what we can do sitting at home, because we do feel helpless.
Yeah, so one thing I feel could be in the health infrastructure space. One could be, as Ruben pointed out, sustenance part, that if you can each one pick up the checkbook here and identify 10 people that they could sustain. Okay, because a lot of people are losing jobs, and the losing of the jobs could have cascading effects. We are on the brink of a civil war, if I'm sounding too alarmist out here, because it's really a frightening scenario. Most of us are not aware of what's happening out there. That's one part. Second is, if some of us who are capable here in this space, if we can start adopting in collectives smaller public health institutions and refurbishing them, making them slightly more robust, because the need of the hour over the next few months and the next 1 year and the next 2 years is all about going to be healthcare, because this is not going to go away. So can we start looking at the health, the robust part of it? We don't even have basic healthcare. And if we can start creating healthcare mechanisms, we all think it's the job of the state, but a lot of things which are job of the state has not happened. And somewhere in that space, if we can doing that. And third is education for education, I would put it that way. Can we look at focusing on education, especially the younger generation? Because somewhere in all this madness that's happening, we are losing track of the younger children, what can happen to them, because a lot of, at some level you might say 1 year lost, it doesn't make a difference, but a lot of these children are going to be at home. A lot of the youngsters who are planning to make careers abroad, they're suddenly going to go haywire. A lot of people who are going to migrate are going to be stranded out here. So a lot of lives are going to get disrupted, and with that, the children are going to be suffering a lot. Can we look at creating a far more systematic approach plan in education for children, and children not really in private schools only? We are looking at children in schools which have lesser privileges. Can we start looking at that? We are putting together an education plan on those lines, and happy to have some of you work with us in trying to strengthen some of these, because the government is very bankrupt at this point in the real sense, ideas and money both. And in that, some of you have great ideas. I've seen Ganesh out here, Govind has been there, Louis has been here, I can see him. Some of you I've not met, but I'm sure there are so many great ideas. So it's not as much money as much as ideas, because those ideas can get implemented in a far more better manner if some of us get together. So healthcare, infrastructure-wise, healthcare, mental health, which I've already spoken about, education, sustaining even 10 people or 15 people in small batches through income, or support systems will help those many families going which are really on the edge right now. And each one trying to, I'm sure each one is capable of doing far, far more. But once you spread the word, a slightly better ecosystem can emerge. Otherwise, they're very quickly slipping away from us.
Well, I think that initiatives like yours give us a lot of confidence and help us do more, because there's always that feeling of, we're not sure where the money's going, or, who's really doing the work. But when we talk to people like Ruben and Patik and you, and we see the detailed mapping that you're doing, ward-wise lists and voter registrations, who has a local ration card and who doesn't, and all of that gives us a lot of confidence that, that drill down detail has happened. And similarly, I'm sure you've mapped all the healthcare facilities in the different wards. So maybe the first thing to do is say that, what are the low hanging fruits? What are the ones that need a little push to get them to a acceptable level? And, what is kind of the funding requirement for that? Or what is the time commitment? Do we need people who are, good at project management or financial planning, or what's the kind of skill sets we need, and what's the kind of funding we need to get the low hanging fruit at least taken care of? I mean, and I think this is a great group to talk to about this, because all of them would happily, get involved in such efforts.
Amita, can I just jump in here? Can we start thinking beyond Bombay, for a moment, because a lot of attention happens in Mumbai. And I'm sure Ruben and Pathik will agree that, there are smaller districts which are not too far away from Mumbai. Or look at classically, COVID happened. Greater Mumbai has COVID facilities, but people in Thane did not have any COVID hospital. And whereas Thane is right next door, I can scratch my back and I can touch somebody in Thane. Is that close? And there was no COVID facility. People had to come from Thane all the way to somewhere this side. But can we look at districts around Mumbai, districts beyond? There are 48 districts in Maharashtra. Can we all look at having one good, robust healthcare facility in each of these districts? Create a public-private people participation. There are government hospitals. Get private sector expertise and rebuild that hospital. I know private sector is going to be stretched also because of whatever's happened over the last 6 months, but maybe a little bit from each one. Healthcare is going to be a game changer, and it's not too difficult to put together a math. If we manage to build a robust system in BKC within 15 days of some kind of a healthcare for 15-20,000 people, I'm sure some of us get together. There's so much more that can be possible.
That's absolutely true. Ruben, would you like to add something to this?
Yeah, I think one specifically, those of you all who actually have employees in offices and can spare some of that workforce to us. There is a lot of administrative work which we right now are dependent upon our volunteers, and I think as the lockdown opens up, we'll have to go back to our jobs. So for us to sustain, if some of that workforce can be sent to us, we can sort of outsource some of the work over there. That's number one. Number two, as Shishi said, she spoke about the healthcare. I am still focused on the food aspect of it, because the only way is to adopt these wards. I think right now we have some visibility in the 5 wards that we've adopted along with Project Mumbai. And I think going forward, we require more people just adopting those wards and looking at the distribution and just looking at the data. I think even if we are able to do just that, we'll be able to get the government to at least respond in a way that is actually tangible.
So Amita ji, I would like to add one more to what Shishir just brought up, education, because we are in the month of June now, and we'll be looking forward to basically in the next 2 months schools being opened up, especially for the blue-collared people. Not all blue-collared people's kids go to BMC schools. They go to private schools as well. Like my housemaid kids go to a school which is private near my house. So if we can build a particular platform where this identified demand of school fees for these such people, maybe even if we have a network of, even if we look at our close network, which is more than a few thousand people, and if they can refer certain people whose kids fees needs to be paid, that's a model that we would like to definitely work on, and that's something that's sustainable, which we would like to work on.
Sorry, Amita ji, sorry, one more thing. Sorry, walked a lot of the time, but we recently got a lot of supply.
You're not audible, Ruben.
Okay. Hi, am I audible now?
Yes, much better. Thank you.
Okay. So recently we got a lot of material supply from distributors who couldn't distribute the material, and this is everything from potato chips to biscuits and gulab jamuns and all kinds of stuff. So that stock is lying somewhere. That obviously can't be distributed in the next few weeks or whatever. If that's available through your networks, please give it to us. We'll ensure that it reaches the right people. So that's one particular concrete thing that we can ask you through your networks if you can help that. Second is a lot of what we're also being given to understand is a lot of the export is not happening on time. So there's a lot of supply lying there, and this is anything ranging from vegetables, fruits, to various other commodities. And I think if for some reason it's just lying there and it's lying in a state of limbo, if your networks can help us, then that will help us in a big way. Lastly, ma'am, right now today I'd like to also acknowledge Maya, who has been Maya Patel, who was a volunteer referred to us by you, and today we've got the Aditya Birla Sodexo canteen active. And this is again on the lines of an innovation that you yourself pioneered. At the Parle East factory, you had the Sodexo canteen where it was an annual contract. We had the people there, and we got it activated. And we adapted to the supply of Nehru Nagar, which is basically a containment zone. Right now, we've been able to do the same in the Aditya Birla school, where we actually have Maya, who's pioneered that, wherein you actually have an annual contract, you have the Sodexo people. You need a little support from us, and because these kitchens are not active, we're getting them active, and we are linking that to a fulfilled supply basis of hunger map. Right now, there are a lot of corporates whose kitchens are not functional. You actually have annual contracts. If we can get those activated and we can get that food being cooked, I promise you here, and I think I can say that on behalf of Shishir and Patika, that we'll make sure that reaches the right beneficiaries. So I think three very specific, concrete ways of partnering, and I think there's a lot of innovation when we use this unused capacity across these corporates, across these kitchens, which are lying unused and which have annual contracts right now. Sorry for being outspoken.
No, thank you. That's really helpful. And I think, sometimes these ideas just need to be seeded actually, because people, it doesn't occur to them. While it seems very obvious to you because you've been doing this for 70 days now, it just hasn't occurred to some of us, some of these very basic things. So anyone who has any way that they can help Ruben's most recent suggestions here, please put your email ID in the chat box, and Arshia will connect you to Ruben. I agree that some of our volunteers have done a great job. Maya is a alum of ABWA, the Aditya Birla School, and she thought of it on her own. She contacted the school, she got the permissions, and I believe that probably today, tomorrow or the day after, they're going to be ready and they're going to start distributing meals. And I think that's valuable because from my understanding, there was no central kitchen on that side of town. There was a kind of gap in that geography. So I think, if the youngest amongst us, the ones who are in their early 20s, can come up with these great ideas, then surely we can also pitch in a lot more. All of this has been really, really very interesting, a lot for us to think about and a lot for us to do. We don't want to lose the momentum. I think some of these ideas around helping people who have to pay school fees if schools are going to restart, because we don't want that gap in learning. We don't want more and more children falling out of the system. As we know, school is important because there's also a midday meal served. So there's a hunger aspect to school that is very important to think about, and how that, the family kind of depends on the child not only going to school, but eating a meal at school. So all of these things are really, I think, low-hanging fruits that we would definitely be able to support you on, especially given your data-driven approach and your absolute transparency of who the beneficiaries are and you know, how exactly you're able to impact them. I think that there will be a lot of people. What I think sometimes is that, like I said, there's this sense of donor fatigue, that people move on to the next issue. But this situation isn't going to be that quick to resolve. And I think that all of us as donors, as philanthropists, as concerned citizens, have to understand that we are in for the long haul, and to pace ourselves, but to keep being interested, to keep asking questions, to keep reading the newspapers, to keep understanding what people are actually going through during this very difficult time. So thank you so much for joining us this evening. On behalf of SVP, I want to thank you everyone for listening. I hope you found it interesting, and I hope you found it useful. Please reach out to Arshia, myself, Ruben, Shishir, if there's anything that we can do to help you get more support out there.
Thank you. Thanks very much, all of you, for your time. It's fantastic talking to all of you all.
Thank you so much, Amita ji, Arshia, for organizing this and giving us this opportunity. I think it's an honor. More so because I think innovation and enterprise is the need of the hour, especially in peak times like this. Thank you so much.
Thank you,
I can
everyone.
only say,
Yes.
anything that you need, any help, forget you want to do something. If you need help also, we're there to help you out. Okay, so Project Mumbai is always there to help you out. As we say, Mumbai ke liye kuch bhi rahega. And somebody wrote, okay, what's this organization called Project India? So someday we'll be Project India as well, if all of you join in. So, stay safe.
I hope so. Thank you both, and have a good evening, everyone.
Thank
Thanks,
you.
Amita. Thank you for moderating.
Thank you, Arshia, everyone. Good night.
Thanks, Vishnu.
Pleasure. Thank you.